to the lecture theatre. Okay, Maria, are you ready?
I am ready.
Good, let's go.
Thank you, everyone. So my name's Maria Pao, and I am looking at the impact of coaching intervention for people with polydrug or multiple drug and alcohol issues, maybe including behavioral. I'm not too sure about that yet, but usually it's all inclusive, and also for comorbidity, because it is well known in the literature that addiction issues are comorbid with either depression, anxiety, bipolar. It's usually got a mental illness component to it. That's just a little bit of my background, the things that I've done. So I'm what you call in the industry a peer. So someone, as you can see at the top there, someone that's very open about my past. And what I'm calling the intervention, courtesy of my supervisor, is collaborative peer recovery coaching. And that is a very collaborative, the client's at the center, I'm a peer, I've gone through the problem, which is addiction and comorbid issues with addiction. And I was just a keynote speaker for the Addiction 2015, and really building up a media profile to really put to the forefront of the peer kind of recovery model, which I was talking to Linda before that. The recovery model is really the way to go. So what I'm looking at is the impact of collaborative peer recovery coaching on people with polydrug abuse issues. And I guess the starting point is sobriety, and then we're looking at whether sobriety improves engagement, mental clarity, emotional stability, and whether or not it does help to build up recovery capital resources. Now, how I'm going to be doing that is, in the last 3 years, I have recorded every single video coaching session that I've had. So I've got maybe around 30 to 40 clients that have gone through 12 complete sessions. So one complete coaching series is a 12-session series. We begin with stating the goals, writing it down, inspiring them with it, doing a strategy session, and then making sure it becomes a reality by the 12th session. So I'll be looking at those 12 sessions of the 30 to 40 people, and I'll be running them through the metrics that's used in the field, which is your audit, your assist, which is a combination of drug and alcohol, a DUDIT. Then also, as you can see, assessment of recovery capital, and you can see there all the different criteria that while I'm listening to the recording, I'll just be marking that data in there, so I can see whether have they increased their recovery capital resources, have they decreased their alcohol and drug use, to what level, and all of that. So it'll be a quantitative and a qualitative case study explanation of what I've found. And emotional stability will also be looked at, as well as mental clarity or mental clutter, which are really big issues for people that are recovering from polydrug comorbid issues. Now, study outcomes, I'm told as an insider, I should really have pretty much no outcomes to say, as I'm not kind of leading it towards that. But what I'd like to measure is, does collaborative peer recovery coaching decrease or eliminate alcohol and drug use? Does it increase recovery capital resources, emotional stability, mental clarity, and overall mental well-being? And why that would be useful is, I guess we all know we've got an ongoing addiction epidemic at the moment, and this will really help and prevent the lives that are lost to that, and give us, there's alcohol-related issues, there's many issues concurrent or within addiction, like domestic violence and suicide rates, and all of that hopefully can be alleviated through coaching interventions by focusing on the client, delivered by a peer, and really encouraging them towards an outcome. And there you go. sorry, I'm confirmed. And
Last week?
yes,
Yes.
like recently, the ink is fresh. I'm confirmed. I'm starting my literature review, and maybe I should be done by the end of 2017. That's the goal.
Maria, I've got a question, or two questions actually. One's about the ethics in
Yes.
terms of patients and the confidentiality and that sort of
Sure.
stuff, and how that was kind of, dealt with.
Sure,
Because
sure.
obviously you're a private business as distinct from, say, working with Queensland Health or something like
That's
that.
it. Well, we when I engage them, they sign a document that says this is coaching. We're not clinical. We're not hiding.
Yeah.
We're actually accepting and championing and being very open if we want to be. So the video sessions are going to be used for training other coaches, and it'll also, because I envisage that I will be doing some sort of a doctorate around it, so I also made them sign that we're going to use it for research and training purposes. So that, and obviously I'm going to be coding them, so no one can tell and no one's going to be listening
So,
per se.
yeah.
Yeah.
Yeah. The second question is, you've talked about rural and regional stuff there, so is your business on the Gold Coast, or are you looking at doing this across a number of sites?
Well, the reason why I put that there is that it is of special interest to rural.
Yeah.
Why? Because 90% or 80% at the moment of the ones I'm going to be examining, they were all done via Skype and phone sessions.
Yes.
So it will really arrest that type of issue that we have with rural
Lack of
shortage
service,
of intervention giving especially for AOD.
Yeah, that's exciting.
But also the shame that people have having to turn up to a clinic to get that help, because if they're getting the coaching dial-in, you've not got that, because in a small country town everyone knows who's going to the family planning clinic and the counselling. Yeah.
That's it, and the coaching intervention is just so positive. It's all over TV. They've got a vocal coach and a health coach and a finance coach, so it's less stigmatization. Yeah. Yes.
You mentioned collaborative. Correct me if I'm wrong. When you say collaborative, as in your intervention on top of what's existing, or a number of interventions yours included?
No, what I mean by collaborative in the context of my coaching is it's not about me, it's about the client. So when we sit down, we look at all areas of their life, and they dictate to me what are their 3 priority areas that they want to name an inspirational goal in that particular session. And that becomes the outcome, or that's what we work towards. So that's what I mean by
So
collaborative.
it's essentially the coaching, I suppose, is the intervention. So
Yes, it is. It is. And collaborative has got nothing to do with anyone except the client and the coach. Yeah, that's it. Yeah.
Any other questions?
Maria, you didn't mention the work-based aspect of your research,
You know I did.
that's why I'm bringing it up,
Yes,
with regard to a workplace manual or a training manual.
That's
Just
it,
say
exactly.
one quick word on that.
Sure. So after I've done my interrogation of data, I'll be looking at the presenting themes and the useful information that dictates best practice in collaborative peer recovery coaching practices, and I'll be making a manual about that. Either I haven't clarified exactly yet, maybe it'll be both, time permitting, but there'll be one for people choosing to study, and there could be one for the client as well. So we'll see.
What this study does represent is an interesting case of using secondary data as opposed to collecting primary data. This is data that has already been collected, and it's data that has already been collected with permission. So does Maria still require an ethics approval? Yes, she does. Why? Because she'll integrate it into her research, but it's retrospective. And so all the university will be saying is, retrospectively, the risks, etc., were considered and taken care of. So there are times where you can actually look at secondary data that has already been collected. The other thing that's quite visible now after the 70th presentation is we have the research, but then we have a practical outcome. In this case, a manual. And this is what professional studies does. It says, here's a problem, here's our research, and here is a training program or a manual or an app or whatever the case may be. So bear that in mind. We've got that dual nature, the project and the research part of the study. Any other questions? All right. Next presenter. I'm very excited about Maria's study. Again, it just illustrates that we're in the business of making a difference. And if not if,